It's time for the Money Puzzle Podcast. With good conversations and realistic solutions to the money puzzles we all face every day. I'm your host, financial advisor, chartered financial consultant, and president of Edgen Insurance and Financial, Robert Edgen. Now let's get this show started.
Hi there, hello, and welcome to the Money Puzzle Podcast. I am Robert Edgen, and I'll be your guide for the ride for the next few minutes. Each week, we look at a different piece of the money puzzle and practical ways to solve it so you can have the financial confidence you deserve and the future that you dream of. Now, I'm flying solo today, but only for a moment because I'm about to introduce a special guest that we've got on the show to discuss an important part of the financial puzzle, especially as you get into that retirement stage in those retirement years, Medicare. Now, you might be thinking, why the heck would I ever want to know about Medicare? Well, because it's important, because it's a vital piece of your retirement puzzle, because it is something that you've been paying for through probably most of your adult life, because every time that you get paid and they take out FICA, a part of that FICA tax that you're forced to pay is going to pay for your Medicare. So you're going to have it. You're going to have to use it. You get penalized if you don't do it right. So sit down, buckle up. I'm about to have Kit Rupe in here as our special guest to tell us everything we need to know about Medicare. All right, so I'm here today with a friend of the office and an expert that I rely on, Kit Rupe, yes, who is here to talk to us today about Medicare, Medicare supplements, everything to know about Medicare, because as we have discussed, if you're not great at dealing with money, work with an expert who is. And if you're not great at dealing with Medicare or you don't want to learn all about it, find an expert who knows about it and can help answer questions. So I appreciate you joining me today.
My pleasure. I'm grateful that you've invited me and given me this opportunity to talk to everybody. And
absolutely. So why don't you do me a favor, and all of us real quick, just tell us about yourself. Give us the quick Kit Rupe rundown and what makes you good at doing Medicare planning and why you love it.
Why I love it.
Yeah.
Well, I love it because it's so complicated and nobody wants to deal with it.
I agree. I'm one of those people. Yes.
So very good. I have older family. I have cousins who are in their 80s, and I always saw them struggling with Medicare and when should I and when shouldn't I, and older brothers. So as one of the younger generation, I thought, well, maybe this is a problem to be solved. Mm-hmm. And I'm really good at these kind of difficult, complicated things. So I started doing Medicare and I got licensed about 2017 and started learning a little bit more about it. Every year we have to go through training, and then we have to go through training for each of the different companies that we represent. I am a licensed registered agent in the state of Colorado to just do accident and health insurance, and I specialize in Medicare.
So, got it, which is a heck of a specialty.
Heck of a specialty.
So, yeah, in fact, I know, lots of colleagues of mine, and we do, they do some accident and they do some health, they do this, but nobody wants to touch the Medicare stuff. So, and I agree. I think it is because of what you said, it is more complicated. There's a lot to learn. There's a lot to know. Yeah. And, we like to team up with folks because we understand you can't be an expert at everything. Right. And if you can't, let's work with people who are. Yeah. So you've been doing this for a few years and you've got some experience doing it. You're licensed with a lot of companies. And so now you're going to answer some great questions. For example, I think we should get started with, when do you normally need to file to start the Medicare process?
Very good. Well, it's pretty simple. Let's not make it real complicated. We're just going to answer some simple questions. Medicare, you're eligible at 65. Everybody who's worked or is an American citizen or is naturalized citizen is eligible for Medicare. And we've prepaid that insurance over all the years you've been paying your taxes. So now you're getting to be 65. 3 months before you turn 65, you're going to get your Medicare card or enroll in your plan, stuff that you need to be focused on. Then you turn 65 and you have 3 months after that. So you don't have to rush into any decisions here.
You've got a 6-month window, 3 months before age 65, 3 months after age 65.
Right.
So, okay. And I love how you phrase that we've all prepaid, for this insurance benefit that we get, because we have, when you were working and they were taking out your taxes for your FICA, a part of that is going towards this program.
Exactly.
Right?
Exactly.
Yeah.
So now let's say you're getting ready to turn 65 and you don't know. I mean, we're all enrolled in Part A. Now we need to get enrolled in Part B. And then we have to figure out which ones we're going to do of these different plans that we'll get into. But age 65 is one of the magic numbers. Now, if you're fully disabled and 55, you could very well become enrolled in Medicare because of your disability.
You can get in early.
You can get in early.
Okay.
There are some people who have some occupational situations where they get hurt and now they can't work anymore. You can get in early there as well. So those are some of the different things. Now you might say, well, I'm working and I don't want to take Medicare. Well, there are some opportunities after you're 65 that you get a forgiveness period where maybe you're not enrolled in something, you don't think you are. And now you can be enrolled in and get into Medicare. And it's not during that window that we previously talked about. But that's the ideal time, right?
Okay. 3 months before you turn 65 that's the ideal time. And what is the process of filing? I mean, do you get online and do it? Do you find someone like you and do it? What's the easiest way to get it done?
So a lot of them will tell you, go to socialsecurity.gov/Medicare or just Medicare.gov. And you can make sure you'll be enrolled in Part A. But now you want to make sure you're enrolled in Part B. And that's really pretty easy. You just say, hey, it's 3 months before my birthday. I want to enroll in Part B. And they will withhold a premium. This year in 2020, the premium's $144.60. And
Is that a month, a week, a year?
That's a month, and it comes out of your Social Security, or they'll bill you. They'll be glad to send you a bill. You can pick monthly or quarterly, or you can do it at different stages, so to speak. Okay.
So we're talking about these Part A's and Part B's, and really nobody's going to know what that is.
Yes.
So let's break down. There are 4 components to Medicare, right?
Right.
A, B, C, and D.
Yes.
Okay. So let's look at each one. Part A, I know, is hospitalization, which you said everyone gets and everyone is enrolled in if they are a citizen, a naturalized citizen, those things that we discussed, right?
Yes. Well, and they've worked 10 years or 40 quarters.
40, right.
Yeah, it doesn't have to be consecutive. It's 40 quarters that you've been paying taxes. So you're automatically enrolled in that, yes.
Okay. So when you are enrolled in Part A, that gets you hospitalization, but what does that mean?
That means if you have a surgery or something of that nature, you have a heart attack and you go in to the hospital, that's going to be covered by Medicare to a certain extent. And then all of a sudden it starts to become your responsibility. You're going to have some deductibles and some prices that are going to come back to you. But it covers your surgeon, it covers your whatever is going on in that hospital, the drugs and everything else that go on in that hospital. Okay.
And from my understanding is that if you have Part A and only Part A, then it typically covers about 80% of things. Is that correct?
It depends on if you're in day 1 through 20. And then it goes in these different phases as to how much it's going to cover. And you have to remember, Medicare doesn't have a maximum out-of-pocket price. So once Medicare quits covering you, boom, you're in for some money. I mean, you could be on one instance of where you're in for a heart attack, and now you're staying in there a few extra days or a few extra weeks or a few extra months. It could get pretty darn pricey. Mm-hmm. I think the worst case in the first instance is $13,000 out of pocket. That's pretty pricey.
Yeah.
That's not covered by Medicare.
It's a big out of pocket right from the get-go. So Part A is hospitalization, everyone gets, and then after that becomes Part B.
Yes.
So what does that add in when we add in the Part B?
When we add in Part B, that's an out surgery kind of thing. Your emergency, like go in with an ER and the ambulance comes and gets you. It's your doctor's visits, could be your durable supply that you need for yourself. There are some standard tests and that sort of thing that you might get, like a wellness checkup or your regular routine checkups. Nothing really elaborate.
But Part B is a choice, right? Not everyone does not get Part B. You have to choose to enroll in Part B.
That's actually very true. Yes.
Okay. And does everyone typically do that?
The most people I've seen, yes, they typically do that. And sometimes they don't realize it. If they're on their company's plan with Medicare, which you can go to your HR department and sign up for, they will enroll you in Part B, and it'll be under their plan. So it may not show up on your card, your Medicare card, but everybody typically does. I've met maybe out of hundreds of people, one or two people who haven't done it. Okay. For whatever reason. But it's a good thing to do, because your doctor's visits, that's also certain labs are covered under your Part B. Yes.
But you probably go to your doctor more regularly than you go to the
lab.
To the hospital. To the hospital for hospitalization.
Right.
So Part B, and that was where that premium was that we were talking a minute ago, which is you said
$144.60 in 2020. It changes every year.
Right.
So, and I'm not sure exactly how they calculate that change, but it does change. You have to realize you've been prepaying on all this stuff. There's some things that are not going to be covered necessarily, and so that's the difference here in how it works. So there's a penalty if you don't enroll in your Part B within a given period of time. For every 12 months that you are eligible and you didn't enroll, there's a 10% penalty.
So that 3 months before, that 3 months after, when you were 65,
yes, if
you did not enroll and then you waited till you were 67 for some reason, then you would have about a 20% penalty.
Yes.
And is that something that only lasts for a certain amount of time, or does it last forever?
Lasts forever.
Yeah.
The only exception might be if you enrolled before you were 65 and you had a penalty. Then you reach 65, you have another instance where you would enroll, and then you could kind of shave it off. But most people don't. They do it at 65. So it's really important that they realize they need to enroll in Part B.
So, okay. So you got to enroll in Part B. Now, I know in the alphabet, ABC comes next. Yes. But when it comes to Medicare, it makes more sense to skip to Part D first, right? Because Part D is your prescriptions.
Yes.
Right?
Yes. Yeah. So Part D is only your prescription drugs. So it's very important that you do enroll in Part D, because if you are insulin diabetic or if you're taking regular routine medicines, they will be covered or at least recognized under Part D. Now, if you don't enroll in Part D, it's a 1% charge per month over the national average. Who needs all of that? It's not a big price for prescription drugs. It's pretty reasonable. And so I encourage people to just enroll in a Part D plan, and we can always shop for one that's not too expensive for you if that's the case, right?
But if you don't enroll,
there's a penalty.
When you're eligible,
right,
then again, you face a penalty.
Right.
So, and correct me if I'm wrong, I think a part of it is, they want you to enroll sooner rather than later when you're eligible. This is just me maybe being a little facetious, knowing that you probably don't need those things right away, might be for later on, so they can collect the premiums without some extra payouts, maybe when you're a little bit younger and healthier. That helps offset some costs when you're older and less healthy. I'm not sure if that's true.
Well, but I mean, if you think about it, nobody plans to wake up tomorrow and be seriously ill. Nobody wakes up and says, today I think I'm going to get cancer, or tomorrow, I think I'll have a heart attack this week. Nobody does that. And so that's what risk is with insurance. And so it's better to take on a smaller cost so that if something really happens, you may have been paying into it, but you're really saving yourself some money. I mean, if you think about it, if you have enough of these penalties built in, you're really paying unnecessary costs later on down the road. Right. You're really not averting anything too much. So,
well, and it's that whole conversation of risk management, which I deal with all the time. You're trading little checks or little premiums, so you don't have to pay the big checks when really bad things happen. It just makes sense. So Part D covers your prescription, and then Part C, we'll go back to that. That's Medicare Advantage. But can you explain that for us?
Yes, that's Medicare all rolled into one. So in a Medicare Advantage plan, you have A, B, and then you have this other aspect that is adds on these things that are not part of Medicare. It can be vision and hearing and dental. It could be routine foot care. It could be some additional aspects, depending on the plan that you pick, that will really help you with what your needs are as an individual. And so a Medicare Advantage plan, everybody says, well, why is the premium zero? It's not. Your Part B premium that you're paying is the premium that's covering it if you have a zero premium. And so there's no such thing as a free lunch, right? And so
free insurance.
Or free insurance. But at least you understand it's not really a zero. It says no cost premium because you're already paying it out of your Social Security, or out of your Medicare payments.
But a Part C allows you to customize some more things. Is that correct?
Yes.
Now, if you customize them, if you add on more of this and more of that, then I'm assuming it increases the premiums the more you add on?
Only if you add dental. The only thing we've ever seen, at least at this point, is dental. Now, having said that, you have co-pays and co-insurances that you have to pay for. And those co-pays and co-insurances do come out of pocket, but only if you avail yourself of them. So I could go in with what seems to be a zero premium because I'm paying my Part B premium and maybe just go to the doctor. And in some plans, there's no cost to the doctor. And I may need some labs, and those labs may have no cost. And it seems like it's a free lunch. It's not. But that's where you have some control of your costs. And then if something happens that you need to maybe go in for vision, you can actually get some vision checkups for once a year for your eyes. And you may not with the glaucoma, but glaucoma is covered under another part of Medicare. So there are ways of handling it. But a Part C is the whole shebang. And you can also get it with or without prescription drugs. So you can tailor a little bit about your prescription drug choices there too.
Okay. And the Part C, the Medicare Advantage in those plans, those are typically sold through insurance companies, correct?
Right. Okay. So I personally represent Humana, United Healthcare, and Aetna. But I also have supplement plans with them as well as Mutual of Omaha, Medico, and a few others. So just to kind of give you a flavor, I like to shop for people and customize it to what their needs are and where they're going and who takes it. So if you tell me who your doctor is, I can tell you if a plan actually has your doctor in it or not. How many times have you seen people buying insurance online and then they say, well, I have a problem. My doctor's not there.
Right.
Do not assume that your doctor's going to have the plans that you're looking for. And that's what's the advantage of calling somebody like me is you tell me what your plan, I can actually find a plan that has your doctor, your prescription drugs, your dermatologist. I think the one I came up short on was the chiropractor. So, but I mean, you can really get quite a few of the people to be covered in your plan. And by having these choices, it's a better fit. We can get a better fit.
And what does it cost when someone uses someone like you?
It doesn't cost you anything other than I'm going to get a commission. So I get a commission and that's how I receive income. But I have to be frank. I don't look at my commission schedules because I don't want to be money motivated. I'm service motivated. I want to pick the right plan for you so that you're happy and you stay with me forever and ever.
Right. Well, and that's
right?
the same way we look at it with our clients.
Right.
We want it to last forever. And if you have the right motives and if you're helping people, the other things follow, like earning a living.
That's right.
But the main point is it does not cost individuals anything to use a professional to help them decide.
Right. So if you were to call me up and ask me, hey, Kip, can you come over? I want to just learn a little bit more about this and what the prices might be for these different plans. I will come over and we can sit for an hour. If you have a lot of coffee and you want to talk about other things along with this, we can stay a little longer. Because really, I want you to be comfortable working with me and I want you to be happy with whatever choices we make. So if you need more than one visit, which has happened, I don't know if that's what I want. I want to talk to my dentist. I'll be glad to work with you because in the end, I want you to have the best fit.
That makes sense. Now, here's a question that I hear. I'm turning 65. Should I stay with my employer's health insurance plan or should I leave and go do something through Medicare?
I think you should shop. So you can go to your HR department and talk to them and ask them, say, do you offer any Medicare plans? Some of them do and some of them don't. And if they don't offer the Medicare plans, you can come and talk to me. And I think you opt out of your employer's insurance at that time. You might have been paying $700 a month or $800 a month for your insurance, where you could actually be doing the $144.60 and getting a Medicare Advantage plan for $0 and having really excellent coverage. It saves your employer and it saves you money, and you can use that money somewhere else. If you decide you want to stay on with your employer, then that's fine too. You stay on with your employer. But when you get ready to retire, we have to make sure you're going to get your Part B set up before you leave for retirement, because it's the government. It takes a while. And so now you get your Part B to come out on your Medicare Advantage or on your Medicare card. And now I can enroll you in the plans that are suitable by what you need and your expectations are.
So you can help them customize it, figure it out, do all those things. And make that decision, should you stay on your employer plan or should you not? And shopping just makes absolute sense. So why would you not at least get the information to find out which suits your personal situation better?
Right.
And if they do shop around, if they do find out that they can save those funds, one of the things that we talk to all of our clients about is when you're in retirement, you want to control expenses.
Right.
And if you are approaching retirement, you still want to control expenses.
Exactly.
The less that you have to spend on things like health insurance and medical bills, then the longer your retirement plans can last. So yeah, definitely a good idea. Now, I know that open enrollment starts October 15th. However, it's more for changing plans. Can you just explain, when people can enroll or change plans?
Very good. So we certainly said around your 65th birthday, 3 months before, 3 months after. Let's say you're not really happy with it, and this is just very general. You can come in and see an agent such as myself between October 15th and December 7th for your annual enrollment. That's when you can switch anything you want to at least once. Sometimes you can do it several times. And whatever the last choice was is the one that exists, not anything before that. Then you have what is called open enrollment. Let's say you were having trouble with your Part B, then and you missed annual enrollment. What the heck? You're off your employer's thing and you want to come in. We can enroll you between January 1st and March 31st and get you set up. Now, let's say you were on a supplement plan with Medicare, and we didn't cover too much about that, but you're on original Medicare with a supplement plan, and you decide to go to a Part C plan, and you're, I'm just so unhappy with that. There is a period from January 1st to February 14th where we can switch you back to those plans with no problems at all. So those are the big kahunas. There are some other special areas, but that's why you need to call me.
That's a lot of different windows, a lot to keep track of,
right.
But that's what you help folks do.
That's what I do, yeah.
Okay, got it. All right. I think that's been some great introductory information about Medicare, about when you need to sign up, about kind of how it works, the big four components of it. What if folks want to ask you more questions or get a hold of you? How would people reach out to you?
Thank you. So I have a website. It's RuPay Insurance, all sandwiched together.com, or you can call me at 719-238-4656. I can come to your home. I can come to your place of business. We can have coffee. Just give me a call. There's no obligation. Let's just see what works for you.
That sounds great. And I'll also put Kit's information in the show notes directly below the video, as well as the podcast information. So make sure that you check it out there as well. Kit, thank you for spending some time with us and for answering questions. I appreciate it, and I appreciate the help that you've given to lots of our clients.
Yes.
So we appreciate you being here, but thank you very much.
Thank you. I'm very grateful too, and thank you all.
So you got it. Thank you, guys. That's it for this week. Until next week, be safe, go have some fun, and do something to improve your money puzzle. Your future self will thank you for it. Have a great week.
Registered representative of and securities offered through Securities Management and Research, Inc., SM&R. Member FINRA SIPC. Investment advisory services offered through BFC Planning, Inc. Edgen Insurance and Financial Services, Johnson Financial Services, SM&R, American National Family of Companies, and BFC Planning are independent entities. There are risks involved with investing which may include market fluctuation and possible loss of principal value. Particular investments may not be suitable for certain situations. decisions. Carefully consider the risks and possible consequences involved prior to making an investment decision. Our firm does not provide legal or tax advice. Be sure to consult with your own legal and tax advisors before taking any action that may have tax implications.